Clinical Pharmacy Residency Training. Atrial Fibrillation Case. Learning Objectives. Differentiate between the different types of atrial fibrillation. Compare rate control to rhythm control and determine the best use of each. Create a treatment plan for a newly diagnosed atrial fibrillation case. Chief complaint: 45-year-old female presented to ER after being referred by her GP. The patient complained of feeling dizzy and her heart is pounding. History of present illness. The patient is a female, 45-year-old, who works as a teacher. She recently visited her GP with complaints of heart pounding and her not feeling very well. She has had multiple dizzy spells in the past weeks. Her GP referred her to the ER to get an ECG done in addition to more investigations. The patient had a similar presentation a few months ago, for which her ECG showed atrial fibrillation. She was not started on medications at that time as the GP thought her atrial fibrillation was induced by a chest infection she had. Her atrial fibrillation reverted to sinus rhythm within 2 days of the episode. Past medical history. Patient has peripheral vascular disease. She had a deep vein thrombosis in her left calf a year ago. She also had an episode of atrial fibrillation 3 months ago induced by a pneumonia infection. Family history. Her father has type 2 diabetes, and her mother has hypertension. Both parents have peripheral vascular disease. Social history. She is a lifetime non-smoker. She drinks alcohol occasionally only. Home medications. Patient does not use any medications at home. Physical examination. Vital signs showed blood pressure 128/79, heart rate 130, respiratory rate 27, temperature was normal, weight 90 kilograms, and height 175 centimeters. Patient was tachycardic with irregular rate and had normal S1 and S2 sounds. A and O times 3. Laboratory studies were as shown in the table. ECG showed atrial fibrillation with rapid ventricular rate, 130 bpm. Echo showed moderate left atrial enlargement. No thrombus was seen. Assessment. Recurrent paroxysmal atrial fibrillation. Questions. 1. What are the different types of atrial fibrillation? 2. What is the difference between rate control and rhythm control in atrial fibrillation? 3. If the choice was to cardiovert this patient, what would be an important medication recommendation prior to cardioversion? 4. Develop a treatment plan for this patient's atrial fibrillation.